This video is about blood pressure, also known as BP. But firstly, let us get a brief introduction of what we have to talk about in the video. Remember, blood flows in body vessels, that is arteries, veins, and capillaries. This flowing blood applies or exerts a force on the vessel walls. In other words, the moving blood exerts a force on an area of a blood vessel, and that force over that area is termed pressure. But since it's supplied by blood, it's called blood pressure. So therefore, we define blood pressure as the force or the lateral force exerted by a moving column of blood on the vessel walls with the heart systole and diastole. Now, this blood should move at a steady speed in order to maintain perfusion or in order to supply body tissues. And also do remember that this pressure is measured in millimeters of mercury. Now, there are different forms of blood pressure based on the body vessels. There's arterial pressure, venous pressure, capillary pressure. Arterial pressure is most clinical and will be the focus of this video. The normal values pertaining to blood pressure are averaged at 120 by 80 millimeters of mercury, where the top number represents systolic blood pressure, in this case 120. The bottom number represents diastolic pressure, in this case 80. Why are these values important? For that, let us look at the significance. An exaggerated increase in BP will be termed as hypertension. An exaggerated decrease in BP will be termed as hypotension. Now, there are many factors that could cause this, and those will be looked at in another video. Anyways, so this means an independent rise or drop in BP is termed as systolic hypertension or systolic hypotension if it concerns systole. And if it concerns diastole, the same applies diastolic hypotension or diastolic hypertension if it concerns diastole. Next, we will look at the types of blood pressure. First of all, we have systolic blood pressure. Now, this systolic blood pressure is the maximum pressure during the heart systole. That is when the heart is pumping. So the normal values of this range from 90 to 120 millimeters of mercury. And the significance of this, the importance of this blood pressure is it reflects the heart's musculature function. That is, it reflects myocardial contractility. Therefore, many exercises cardiac function, cardiac output. The next pressure to be looked at is diastolic pressure. Now, diastolic pressure is the minimum pressure recordable during the heart rate. The normal values of this pressure ranges from 60 to 80 millimeters of mercury. And the importance and significance of this blood pressure is that it reflects peripheral resistance. How much resistance is referred from the peripheral system. And yet, another type of blood pressure to be looked at is pulse pressure. Now, pulse pressure is the difference between systolic pressure and diastolic blood pressure, and that normal value lies between 40 to 60 millimeters of mercury. And the importance of this pressure is it reflects stroke volume, that is the volume ejected per beat, and also arterial compliance, the stretchability. And then we have mean arterial pressure, MAP. Now, mean arterial pressure is the average pressure flowing in the arterial system during a single cardiac cycle. It is not the average between systolic and diastolic pressure. Now, it is the average flowing in the arterial system, only in the arteries. And the normal range of that lies between 70 to 80 millimeters of mercury. And there's a way to get an estimate of this of mean arterial blood pressure. That is, diastolic BP plus 1/3 of pulse pressure will give us mean arterial pressure. The significance of this pressure is it reflects perfusion pressure. The next thing to be looked at is the measurement of blood pressure, determination of blood pressure. Now, it will be important to know that blood pressure is determined by two methods. Firstly, the invasive method, also known as the direct method, involving the penetration of body tissues. That's what invasive means. Then non-invasive, meaning not penetrating body tissues. Direct method involves insertion of a catheter and the recording system into an artery, and therefore direct method involves the insertion of a catheter into the concerning artery. Often used is the radial artery, and it would be of importance to know that this method is used for continuous BP monitoring. And the next method to be used is indirect method or non-invasive BP method. Now, this method involves the palpatory, oscillatory, oscillometric method, and sometimes you can have the Doppler and the theratonometry. Now, let us look into a little bit of these methods. Firstly, the palpatory method. Now, the palpatory method involves the measurement of blood pressure by feeling for pulse. Remember, to palpate is to feel for pulse using fingers, using the digits. Now, the next method to be looked at is the auscultatory method. Remember, auscultatory comes from the word auscultate, meaning to listen for sounds, listening to body sounds. So scattering method involves listening to blood pressure sounds on concerned vessels, that is sometimes the brachial artery, using a sphygmomanometer and a stethoscope. Oscillometric method is the blood pressure determination using an oscillometer, and based on oscillometric readings, the reading is determined. An increase in magnitude of the oscillations is used to measure systolic blood pressure, and a decrease diastolic blood pressure. And the other method, like Doppler method, I used to determine blood pressure, direction, and velocity. Arterial tonometry allows the measurement of BP in the superficial vessels, like the radial artery. The furthermore thing to be looked at is the procedure of blood pressure. Traditionally, the usual procedure is starting with the palpatory method and ending with the scatteratory method. So first of all, we start with the palpatory method. First of all, you have to let the patient sit on the chair and relax for some minutes, 3 to 5 recommended, and explain the procedure to the patient and make them comfortable. And if they have any tightening or anything, please do remove and loosen the tightening on the arm. Now the next thing is to apply the cuff about 2 centimeters above the intercubital fossa. And remember, the cuff must be applied in such a way that it lies over the course of the brachial artery, about 2 centimeters above the intercubital fossa. Now palpate the radial pulse and increase the pressure of the cuff till no pulse is palpable. That means until no pulse is felt. Now keep your eyes on the scale and note the reading. The time you hear a pulse, and that is the systolic blood pressure, and that is what can be estimated by this method. From that method, we move on to the auscultatory method. So we were using the palpatory method in order to get just a glimpse of where systolic pressure would be lying. Therefore, we move on to the oscillatory method. Now, the respiratory method, with the systolic blood pressure already known by the palpatory method, we have to raise the pressure 20 to 30 millimeters above that of the required systolic pressure. And moreover, we still have to keep the stethoscope on the intercubital fossa and start lowering the cuff pressure gradually. The same procedure still applies. We have to raise the pressure 20 to 30 centimeters above the required systolic pressure and apply a stethoscope on the intercubital fossa. Remember, the proprietary method, no stethoscope was applied, so we put a stethoscope in this case. And the same procedure is followed and the pressure is lowered gradually. And at this point, as we start lowering down the pressure, we expect a series of sounds, and those sounds are known as carotid cough sound. The reading where you first hear the first sound is termed the systolic blood pressure, and the reading when you stop hearing the sounds will be termed as the diastolic blood pressure. And thank you guys, that is the main thing we look at on blood pressure. Any further information concerning the control and everything will be added later. Thank you guys for watching. Until we see you next time, thank you.